You're very welcome to the Irish Political Roundup with me, Paul Brophy.
And me, Roisin Chleirigh.
This week we're chatting with our one of our regular disability advocates is Gladys O'Niell, who's completely independent of let's say mind, body, and soul, as she said. I'm going to talk about a particular subject that's of serious importance. It's the whole subject of intimate care amongst our more vulnerable members of society. Gladys, you wanted to come on tonight to kind of floodlight and highlight um, how, as in care settings, how vulnerable people, in particularly in intimate ways, are treated.
Yeah, thank you for bringing this up. It's not an easy subject. A lot of people don't want to think about it, but it is happening full scale. It's one of those hidden things. I've been aware of it because I was seriously ill in hospital, and it was, even though I was seriously ill, I was aware of my rights, where a lot of women, who are vulnerable or ill or disabled maybe wouldn't be, or sort of thing. So whilst I was in hospital in a step down service from ICU, I needed intimate care about 12 o'clock at night, and the nurse informed me that there was no female available. And so this man arrived, and it wasn't happening. So it ended up in a full scale argument while I'm attached to all this machinery. And then I'm told that I would have to wait for as long as whatever. And I said, well, you let me wait then, and I will make a formal complaint against you. I know my rights. And a presto, this woman, a healthcare assistant, female healthcare assistant, arrived and sorted me out, and whatever the case may be. And it made me think, what happens to women or men, mostly women though, because most women do not want a man attending to them if they need intimate care. And I've become aware of many cases. And what I really would like to highlight is that the reasoning that a lot of people are terrified, older people, women with dementia, and you name it, is that they're terrified of losing their services. So, for instance, if somebody's in respite, if they make a complaint, they're terrified that the HSE or somebody will pull the services from them. And this is always in the back of their mind, because the rights to services are so hard fought for that they're willing to sacrifice their dignity, autonomy for it's heartbreaking. The fact that an elderly person or a disabled person could possibly be treated with such a lack of dignity. And also, I would think, what a case that I came across yesterday, where the man shouted at the woman saying, well, you can lie there then, because we've no female staff. And this level of vulnerability, and I know what that feels like as a woman with a disability, that if you're that vulnerable, how horrendous it is, and it is getting worse. And I want to highlight it. I want, what have we become? Where I thought it was an automatic right to have a female, healthcare assistant in a hospital, in a nursing home, and whatever. And with the case yesterday, the woman did, it was clear in her thoughts, saying, I want a female healthcare assistant. And eventually somebody turned up who roughly handled her, who shouted at her, horrendous. No human being should put up with that. Nobody. And I wonder, I'm trying to highlight this. I think it's horrendous, the suffering of people that have given their life, their taxes, their everything to Ireland, to have this treatment and lack of dignity, at near their end of their lives, so.
Yeah.
That's
I suppose it's also important to highlight as well. There's people working in in the whole care area who are absolutely fantastic and go above and
Oh,
beyond and are
look,
and
I
are
was
are
one of the,
are wonderful people. But when even a small minority kind of behaving like this is
yeah.
still too many.
Yeah, I know. I don't. This is not I don't want this to sound like, because I also worked. I changed career and went into the healthcare system, and I hope, and I actually know that I as a person showed as much respect, to the people that I was dealing with, and I hope I know I was good, and the women that I worked with, bar a couple, but the women that I worked with were dedicated, loving, kind human beings. So I don't want this to be, sort of any kind of statement that there isn't really genuine, decent people. But there is also a problem with untrained, we were trained, highly trained. And I have learned, sort of thing like, what's happening now, I can't prove it, but it's come from a high place of a nurse that's still working within the system. That, the training is up to level 2 of FETAC instead of level 5. It's level 2, and a lot of psychologically unsuitable people to deal with the elderly, to deal with people with disabilities. And I would like to, and that is, I believe, to shift them off the dole, to shift people into working within the healthcare system as healthcare assistants, and again, this is, the bad few that make it really, so the part that I would emphasize on that is that, you don't want to be at the end of the bad one, have that life, to have that experience. You don't want to be that one that was unlucky enough and we know we don't know everything that's going on, but one nursing care assistant, or whatever you'd like to call them, healthcare assistant, was wandering around in a nursing home, who's now in prison, who was raping, Alzheimer patients. So it is a disgusting, harsh reality. That's not talked about, and that's why I'm talking about it, because it's there, and there has to be safeguarding. There has to be safeguarding everywhere for vulnerable, disabled women, and for elderly women, that they have their dignity and respect, sort of, whether they know, no matter what their condition is, that somebody's treating them with the dignity and the respect they deserve.
Well, this kind of goes back to the whole, we have HICWA, which is the Health Information Equality Authority, and their job is to monitor and inspect all care sessions, be they public or private, and if HICWA do an investigation and they find that setting is not up to standard, they have the power to close it. So there's,
and they have done. They made their, but they're not checking. They're not checking what's going on. At nighttime. Do you know what I mean? With male care workers wandering. Now, I do not want to be this blame statement of all males that work in a nursing home or in those kind of setting, or predators. But the fact of the matter is that they should never be near a woman in intimate care. Absolutely no way. And the reason why I'm highlighting this, as I pointed out, that people are afraid to complain, because if they do, services will be pulled. That's the fear, whether it's true or not, it's still a fear. So they're not hearing the stories.
No.
And HICWA can't follow somebody around at nighttime or during
no,
the day.
they can't.
No.
And I know myself, Gladys, I don't have any vulnerabilities. I know I'm 57 now this year, but I know as a woman, I wouldn't want a male healthcare assistant coming near me, or even a doctor examine me. I know my own GP won't examine me on his own. He makes sure that a nurse is in there present, but I know I wouldn't want, and Paul, I'm sure you wouldn't want your mother or your girlfriend either to be examined, or even intimate care, a male with intimate care. I think this has to be highlighted. It's another thing here in Ireland that what women are are treated as a second-class citizen. And I think this is another thing we have to highlight and start putting the spotlights and floodlights on about women, especially the vulnerable people within our societies, people living with disabilities. And again, we've heard many people with the referendum, Dr. Tom Clonan, we've heard all the TDs, well, some TDs and senators talking about people with disabilities. This has to be highlighted, and we need to put the floodlights on it. And the conversation has to start now that women, no woman should have to have any intimate care facilitated by a male healthcare assistant, and especially women with any form of disabilities. It's undignified.
Yeah, but you're going to get, sort of thing like, I mean, there's all forms of abuse going on with the elderly, sort of thing, and nobody's tracking it. It's not, which is major is obviously the intimate care, but you have all of the other areas of abuse, financial, you name it. Sort of thing like, and it is because they're elderly, and vulnerable. They're just ignored, and it is part of this ageism in society is absolutely appalling. We're trying to come to terms with human rights of people with disabilities, but the human rights of an elderly person, they have rights too. They mightn't speak about them, or they're not out there demanding their rights, but they have human rights. And a human right is part of to be treated with dignity and respect and with safety and safeguarding. And it's our job to look after, to highlight it. It's our job to, to bring it about. And it's our job as citizens, and on a selfish reason, if we get it right, it maybe it won't happen to us, because whether all of the Botox people out there, you're going to get old. You know what I mean? It's going to happen. You can't stop it.
I suppose it's important to kind of realize. Well, it's about 80%. If we take nursing homes in general, about 80% of them are privately owned and operated. So, by the nature, private is about profit, and corners do get cut here and there in places, and I suppose that kind of highlights the problem that it's kind of, you're going back to the old kind of maybe what they call neoliberal thinking, that everything should be done by the private market, but the private market doesn't always deliver the best results. And I suppose as well, nursing home fees can be very, very expensive for people. So people need to have confidence that their loved ones are being treated, with dignity and respect, to justify the
well, to be quite honest with you, Paul,
as well.
the reason I got into the healthcare was because of my father. Unfortunately, he was a double stroke victim. He had a stroke when he was 58, and then he had a very devastating stroke, just coming up to his 70s, where I couldn't look after him. He had to, inverted commas, have 24-hour care. And when you're thrown into that world, I mean, your eyes are opened. And though, he was stripped of everything, of his dignity, everything, nothing, I'd leave him clothes, and he'd go down the next day and he'd be in somebody else's clothes, or he couldn't leave money because it would disappear. All sorts of manners that I still find to this day really upsetting. And I thought, and I thought, what could, I just don't. And it was before what they tried to do was community care, that people want to be in their own homes. And it was prior to that, sort of. But they took his pension. If he didn't have family, he would have been stripped of everything. Yeah. If you probably remember that Mary Harney there was a court case, and they had to give back people's pensions. My dad would have had nothing. Couldn't even get a bar of chocolate, or a newspaper. And there was a court case, and all the HSC or whatever, whoever. I think Mary Harney was around at the time anyway. And they had to pay back the money that, but it was too late, for my father was gone. My father was dead. So I'll never forget that, so this is not new. This isn't just, this a new kind of issue. What's different now is that there was care staff, there was highly qualified nurses within the nursing home. Everything wasn't obviously perfect, as I've just stated, but I think now everything has got a lot worse. The country's got wealthy, yet it's got an awful lot worse for elderly and for disabled people.
Right.
So
And two, it's about, we need to go back to core values, and we need to go back to core values of looking after, our most vulnerable within society. And especially, there's been so many crises and chaos when you think about how people with disabilities are being treated. They're at the very bottom of the scale. They're not being looked after. How many people are on waiting lists? The children, have children with disabilities, and the older people with disabilities are the most vulnerable. Well, everybody with a disability is vulnerable, but to actually have to go into a respite or to anywhere and be for a woman to actually be told that you have to have a male healthcare assistant come in and assist you and facilitate intimate care, I think that is really undignified.
yeah, but it's never discussed. Do you know what I mean? It's not somebody would come in. I think it's quite frightening, actually, to think that somebody just would come into your room and you're on your own, and the vulnerability of that, and then somebody screaming at you that, if you don't take this care, and I won't, it's too distressing to actually repeat what he said. Honestly, I mean, we talk about rights and equality and, all of these buzzwords that are constantly put about. But if they don't work on the ground, what use are all of these inclusivity and equality?
Diversity, inclusivity.
But I have faith, if the referendum in care said no, the Irish people said no.
Said no.
But then now we have to yeah, absolutely. We're not a cruel nation. We are not people that we care for our families. I care for my parents, you care for yours. We care. We're not cold-hearted, and we just have to pay people, train them and pay them for the valuable work they do. That would be if I was ruling the world, which seemingly they won't let me, sort of thing, rule the world. But if I did have a magic wand, it would be to value the carer, if you're leaving your little baby, you want to make sure that your baby's going to be looked after well, and they're not even paid properly, but you hope and pray that somebody decent in a creche. I feel the same about the elderly and people with disabilities, that you're entrusting that they will do the right thing and that they will care. But I would pay them, because this is the most important job. Yeah.
And train them,
and
not just up to, as a former training facilitator myself, level 2 is just, it's just like going in and saying, they need at least be doing level 6, maybe level 8, 7, that needs to be trained properly. So a childcare, you have to do level 8 even to be a childcare assistant now. So.
But Paul stated something about private care and profit.
Yeah.
Therein lies the problem,
So Gladys,
I'm involved with a community creche in Kilkenny, and we're very, very fortunate. We'd have nobody below level 6 now, and a lot of our staff have gone on and done doing extra qualifications and gone up to grades level 7, level 8, which is brilliant. So it just goes to show, when you do invest in education, it has a huge benefit to all staff working in whatever area of life they're in.
Yeah, and I think, as a society as well, that we have to have respect for this is, about also the carer's dignity and respect. I've had this experience myself. where you might get a difficult person, you know, berating you, or, you know, thinking, you know, sort of thing like you're some sort of, you know, I don't know, you're there to do a job, you know, sort of thing like, I mean, you're not there to be disrespected. But that was very, very rare, extremely rare for that to happen. And Irish people are, my experience have been extremely great. Honestly, it sometimes brings tears to me, because when I was working before I got sick, the elderly people and the people that I you know, with disabilities that I dealt with couldn't have been more grateful. And, you know, they shouldn't have to be grateful. You know, it should be part of, this is it, you know, this is part of, you get sick, you get looked after, you get old, you know, you need supports, you get supports. Shouldn't be grateful for it. But just beautiful human beings. Just, you know, sometimes they just wanted a cup of tea and a chat, you know, from the isolation. So we can do it. The will, if we had the will, you know, this can be done. This, the right person has to be. I think there should be some psychological training, you know, assessment as well. But maybe I'm going a step too far and wishing too much.
No, I think there should be, definitely, because, you know, if people are in charge of looking after the most vulnerable people within our society, they should be well trained, they should be vetted, they should be psychological assessment, as you said, and they certainly should be trained, and they should be also trained, and it be taken as a given that, you know, they must treat whoever the employer is, has to ensure that there's so many female staff. You see, it's like, it's all this
common sense,
like, but, you know, it's where has it's this referendum, if it's done anything, it's to put the line in the sand that women are saying no. And it's also putting the line in the sand that families are saying no as well. That, you know, we need to start looking after the dignity of women and the most vulnerable within society. Just the exact same way from the mother and baby homes, the thalidomide, the cervical check. I'm missing a couple. Even the studios,
mesh.
the vaginal mesh survivors. There's a list going on and on and on and on, and it's all to do with women and vulnerable people with disabilities. That we're not looking after people within our society anymore.
But I mean, can I say, Roisin, that it was very evident in the COVID, where vulnerable older people were in nursing homes and family couldn't get to them.
Yes.
You know, I mean, there has to be a serious investigation into what's happened. Families, the trauma families have gone through, looking through a window at their loved one dying, is it's like something out of a nightmare. You know, there's a lot of people going around traumatized because they lost their loved one in a nursing home, you know, and all of that chaos, you know, that, you know, and I just know of one case that I would know that because one of the family members was a healthcare assistant, when they gowned up the whole lot, she was allowed to hold her nana's hand while dying.
Oh, God.
You know, I mean, it's beyond belief. And that told us everything, that they were expendable, you know. People with disabilities and older people are expendable. We can, you know, we protect the fit and healthy, you know, sort of thing, like, and the older people can just stay behind the door and stay away.
Maybe now that we're highlighting this tonight, you have started, Gladys O'Niell, you have started this conversation now here in Ireland. I haven't heard this be mentioned anywhere else. Have you, Paul?
No,
I haven't heard anyone else mentioning this. So let's start this, Gladys. Let's highlight that you're starting this conversation. Let's contact people. Let's get people talking about this, and especially to the networks that we have, and invite people to come on and talk about this and talk to you about this. Let's get some politicians on who can do something about it, the legislators.
But maybe you could answer a question for me. It's in every one of our interests.
Yes.
It was me yesterday, to acquire disability. It could be, I don't be, saying anything bad, but it could be you tomorrow. It's in all our interests. And the one guarantee that we have is that if we do get older, you're not getting any younger, you get older. So in a place of where we have that established of care and dignity, for the most part, for the best part that we can, give it our best shot, of the dignity and the respect that elderly people need and want, and if that is possible in their own home, because that's where they want to be. And disabled people want to be not a prisoner in their home, because they need supports to get out in the world and be part of the community, but fundamentally they want to be in their own home. And I mean living independently in their own home. I don't mean living with mommy and daddy at 40. Do you know? I mean living on their own, living independently with supports. And the same with elderly people, sort of thing, with supports. And we can do it. And the country is awash, by all standards, awash with money, wasting money left, right, and centre all over the place.
Well, 23 million euros was wasted.
Yeah, and that money has told the Irish people, have told the government, we want care. We love our loved ones, but it isn't fair that my children get to care for me. That's not the deal. Do you know what I mean? That's not the way it should be. I want to live independently, and independent supports in my control, to live my best life. So it can be done.
It can be done.
Can be done.
So Gladys, I really thank you for bringing this to the attention of Paul and myself, the Irish Political Roundup and Competent Women Ireland. And let's now see if we can get other people to come on and highlight this more.
And if there's any of our viewers out there that have similar stories, please by all means get in contact with. We'd love to hear from you, and of course it'd be dealt with in the strictest of confidence.
Yeah,
absolutely.
And Gladys, we're going to continue this conversation. We're going to put the floodlights on it. And maybe you could keep coming back with updates on this conversation.
Yeah, that'd be fantastic.
And Paul, let's see who we can get on to come on and talk about this. I'm sure it's coming. I tell you one thing, it's coming up to locals and European elections, and it could well be as sooner than we think general election as well.
Yeah, absolutely.
That people are talking at the door when people are canvassing. This should be their questions. What support?
That will definitely be mine,
Yeah. What supports, even local county councils, what supports are you giving to our most vulnerable in society? What care are you ensuring is being given? And they can't run away. What care, even with localities, of even access to certain places? But really, how are you looking into the vulnerable care of the people with disabilities and vulnerable people within your communities?
Yeah.
There's
Absolutely.
so much. I think this is what this program, Paul and I've often said that, coming up to these elections, what we want to facilitate is topics like this and issues like this, Gladys, that you are rising up. You are bringing it to the public awareness that need to be put to the politicians when they're knocking at the door, begging for the votes. That everybody puts the X on their voting thing. This is what this program's about: is getting these topics out there.
But I would ask a question, Roisin. That when you talk to disability ministers or TDs, whatever, the ones that control the purses, they will absolutely dish out, X amount of millions, this millions, that millions, you name it. It just goes into millions and millions, and they waffle on about the millions. And I often wonder, where is that going? Where? Because everybody I speak to that has a disability isn't coming to them. So where? They follow the money. I always say, follow the money. Where is it going?
Is it a case of there's this big pot and it's just chopped up and divvied out 100 different ways, and then whatever you get kind of thing.
Yeah, which is nothing, mostly.
Blocker.
Yeah,
Well,
it's a lottery, two-tier system within that you could be lucky enough to get full services like a PA service, you know, sort of thing, like proper supports within your own home. You can, you know, some people are lucky or not lucky. This is a human right to be able to live independently. Everybody should have it, but that's not the way it works. That is not the way it works. In fact, if you're over the age, if you're a pensioner, you're not, they don't even look at you as disabled. Believe it or not, you aren't dealt with, is that the right word, as disabled. You are just old. So they cure you, actually. Do you know what I mean? Magically cure you. You don't no longer have a disability. You're just old. It's just incredible, you know, incredible what goes on. And you only know this when you're in the middle of it, you know. So, you know, that's why I try to highlight it.
Well, Gladys, thank you so much for taking
You're
the
welcome.
time and the bravery, because I know, you know, it takes a lot of courage and bravery to actually talk about this issue, especially about intimate care for women. And that takes a lot of courage because, as you said, a lot of people are too now, because of all the censorship, the ghosting, the cancelling, the gaslighting, and people are afraid now to speak up. But maybe after this referendum, maybe people are speaking up. And there is going to be a Women Are Speaking event in Limerick. And I think by the time this goes out, there'll be a press statement in Limerick. So if anyone's listening to this, if women are listening to this, then please do attend the Women Are Speaking event and have your voice heard at this event, because women of Ireland are speaking up, and so are the families of the most vulnerable people in Ireland standing up and speaking up and showing up. Gladys O'Niell, thank you so much indeed.
You're welcome. Thank you.
Until
Thank
next
you, Gladys,
week.
for your time.
Thank you.
And thank you, the listeners and the viewers. Thank you so much for taking the time to watch this video. Paul and I really appreciate your support, your likes, your comments, and your shares. And it's not to share our platform, it's to share the message of the people of Ireland, just what Gladys has done tonight. So if you like, you comment, and you share this, you are spreading the message of intimate care with the people who are the most vulnerable within our society here in Ireland. Until next week.
Goodbye.